Welcome to Practice Pearls, Overcoming Therapeutic Inertia. Today we're going to discuss quick tips for getting copays covered fast. I'm Dr. Neil Skonlnik, Professor of Family and Community Medicine at the Sidney Kimmel Medical College of Thomas Jefferson University. And joining me today, I'm privileged to have Dr. Eden Miller. Dr. Miller is an osteopathic board-certified family doctor with the High Lakes Healthcare in Bend, Oregon. During medical school, she developed type 1 diabetes, and then she chose to merge her personal experiences with her primary care background, and so currently works both as a diabetologist as well as a primary care family doctor. She's an impassioned speaker, having given over 500 lectures on diabetes to healthcare providers and to patients alike. Eden, welcome.
Thanks so much, Neil. My pleasure to have a little chat with you today.
Just to level set, I want our audience to understand that therapeutic inertia is defined as the failure to advance or to de-intensify the treatment when a patient's therapeutic goals are not met. Part of overcoming therapeutic inertia is getting rid of roadblocks, and of course, that's where addressing copays comes into importance. Eden, let me ask you, let's start with, what are the copay issues or other therapy coverage problems that you and other clinicians experience in taking care of people who are living with type 2 diabetes?
Yeah, it's definitely a barrier that I don't think any healthcare provider doesn't have to overcome. Unfortunately, it seems like our system is designed with impunity to the payers, for sure. And you see this time delay from the exam room for the medical decision making to the actual initiation of therapy. And that's the hardest part. You know, we've made that treatment decision. It gets lost in the handoff to the other team members. And sometimes we don't even know where we are in limbo land with that. And we don't know what to do next or who's holding it up or what barrier kind of exists.
Yeah, it's such a good point. I love the term you used, limbo land, because that really what is what it is. And it's often this black box that we don't even know is happening because we walk out of the exam room and then what happens? Are there strategies that you've found to be effective in addressing either denials or delays in coverage?
Absolutely. Now, I think healthcare providers need to develop their individual strategy, but for me, I've really tried to involve the team members of how we make a very concise way of initiating a particular therapy, handing it off to somebody else, how we're consistent in following up with where it's at. And I do this thing, what I call the 60-second prior auth. And it's really telling an individual treatment story, and I back it with some of the recommendations from like the ADA or what we call a foundation of science. And so in telling this story, I tell it in my note. I actually create this narrative or dialogue about a particular treatment. So when I need some kind of documentation for, the next step in getting that therapy, my staff knows to find it embedded in my notes. So we have this constant team approach of where we're at, so it stays very consistent.
That's fantastic. It sounds like you have a very well-organized office, and I'm going to guess one or two specific people whose job it is to follow up on problems that occur so they know to look in your note. Any other advice you'd offer practitioners who find that copays and getting therapies covered are a barrier?
Yeah, I think one of the things is to reach out to the other healthcare provider teams in your area. I'm in a rural clinic, and so I tend to call over to the local pharmacists and say, hey, give me a heads up if you're having issues so I can know where we're at in the process. I sometimes look at, maybe half therapy or half tablet programs if I'm able to do that. That doesn't always occur for every therapy. Also remember, sometimes a cash price may not be a big financial burden. We love to use some of the manufacturer coupons, but not everybody is allowed to do it. But we really need to have what I say different options or avenues because each person's going to have different barriers that really interfere with getting that therapy.
Can I ask you something? There's certain therapies, some of the newer ones that are particularly challenging, sometimes SGLT2s and GLP1s, where it's so important for our patients because of the cardiovascular benefits particularly if a patient has cardiovascular disease. Do you use that well-defined evidence-based benefit to go after approvals?
when I do tell that individual story, and I try to maximize my time because I don't have any more time than most of us out there practicing, I tend to put it in the plan. And so I might mention that a particular patient has either cardiovascular risk factors, maybe they have adherence issues. And so maybe an injectable weekly GLP-1 might be the best. Maybe we want secondary benefits such as weight reduction, or maybe even we're looking for an A1C reduction of greater than 1%, which certain therapies have and certain don't. So when I embed that into the plan, and I use the word, please let this note serve as an authorization, and I tell that little tiny narrative, and then I back it up with the, as you know, the American Diabetes Association encourages the early utilization of these therapies as they have these contributing benefits, and I pass that information on in my narrative. I think it really goes a long way to communicate to the payer, hey, I'm really thinking beyond just the specific getting the blood sugars under control. I'm really thinking about the whole patient and their disease state.
You know, with time being such a precious commodity for all of us, I love the suggestion of embedding your message to insurers within your note, so you're not, as we so often find ourselves, in the position of having to write a separate letter. That's brilliant.
Yes.
If you had one take-home message that you want people to remember from this discussion, what would that be?
It really is that as you're in the office room, as you're there with the patient, I know all of you as healthcare providers are thinking in your head, this person would benefit from whatever kind of intervention. I know you're thinking it. It's just a matter of placing that on paper, writing it, putting it in a form, putting it in the narrative of the chart. That way, your thoughts, your professional opinion, your standard of care then gets passed on to the next layer or level of getting that therapy going. And it really speeds it up. If you can remember to do that each time, notify your staff that you're going to be placing that information there. They know exactly where to go to get it. And it really maximizes and speeds up that encounter and that time.
Eden, I want to thank you so much for sharing your experience, your wisdom, and your attention to both efficiency and effectiveness with all of us. Thank you so much.
Thank you so much, Neil. It's my pleasure.
For more on overcoming therapeutic inertia, just go to therapeuticInertia.diabetes.org. For the American Diabetes Association, I'm Dr. Neil Skonlnik. Thanks for joining us.